Dr. Brittany from Strathroy Wagner Chiropractic Health and Wellness Centers, bringing you my case of the week. This week's case involves a patient that presented with big toe pain or first metatarsal pain. This was a regular patient of mine who usually came in for either headaches or neck tightness or low back tightness. This was the first time they presented with big toe pain. So I did an assessment of their foot, found that the ankle was a little bit tight and restricted. There was some tightness in the muscles of the lower leg and the arch, and did feel a little bit of tightness or restriction in the movement of the big toe. So for treatment, I did some stretching to the lower leg muscles, mobilized the ankle, and also did some mobilizations to the toes or the metatarsals. And then lastly, I just did some long axis distraction to the big toe. And when I did this, it gave a huge pop. So from this, I concluded that the first metatarsal joint or the big toe was jammed up, or the joint got compressed. Upon talking to the patient about it, the patient reported that because it was springtime, they were working outside, had gotten mud on their boots, and had tried to knock it off by hitting the toe part of the boot on the ground like that. So that likely put a lot of pressure on the big toe area and caused the problem. A lot of people think of chiropractors just as people who treat neck and low back issues, but we can look at any joint, so it's not uncommon for me to look at wrists or fingers or toes or ankles as well.